Hello, everybody. This is Chris Faddis and
Brad Hahn.
you forgot your name.
Yes.
We're happy to join you on Facebook Live. It's been, over a month since we've done this.
Yes.
We've been flying all over the country. You taking a lot of vacations, me working really hard. So,
Yes.
so Solidarity HealthShare. Sorry, that's not fair.
Well,
you worked pretty hard.
Yeah. Well, I don't
2 days a week.
I don't consider this work.
Okay, good. That's good. I do consider it work.
Yeah.
So Solidarity HealthShare, Chris Faddis, Brad Hahn. We're here to talk about. We're going to talk a little bit about Charlie Gard today because I think we owe that conversation some mention. The repeal and replace.
Well,
thing.
I don't know if you call it just kind of keep and accept.
Keep and amend.
Keep and accept.
Yeah. Well, it was Trump care, then it was Ryan care.
Yeah.
Now what are they calling it? Is it who cares? Is that the?
Yeah, I think we need to be more accepting of this though.
Is it tolerant care?
Tolerant.
Okay,
care.
good. Yeah, Solidarity HealthShare, we're excited to be here today. We're going to talk about some issues, but we're also going to do a live Q&A, which has been very popular with our members and folks that are looking at joining Solidarity. So we want you to enter questions in the question box. Brad,
How do we get the questions?
I'll be looking at my phone, which will look like I'm a rude teenager, which I was, but I'll be looking for the questions. So I'm going to be looking for you to leave questions. And so far, none of you have done your homework. So please submit questions. We're going live. We have a lot of our Facebook friends and partners out there sharing it. So before we get into questions about Solidarity HealthShare and why we believe we are probably the best solution out there for Catholics in healthcare, I want to ask Brad to comment on this whole case with the little boy Charlie Gard and his parents in the UK. Can you just comment, if you don't know, if you've been living under a rock or something, Charlie Gard is a young boy who has a mitochondrial disease, who basically the hospital in Britain decided he did not need to get any further treatment. There was no chance for cure. There was nothing they could do about it. And the parents knew that there were some really great things out there that they could seek, but the hospital prevented them from doing it.
Yeah.
So I'll leave it at that.
It was
I want you to comment.
just some simple medication that could help this little kid.
Right.
Yeah, but I think the big question I get is, thank goodness that this can't happen in the United States. And I tell my clients and my friends that it's happening in the United States, these Charlie Gard issues like this.
Right.
And so it comes down to, there's a couple issues here. First of all is autonomy, who's making a decision? And is it the federal government, or is it the family, or is it the little baby that can make the decision? And since we have a little baby here, they can't make a decision, so we have to rely on the guardians. So that's where the true, under Catholic teaching, that's where the decision should be made.
Right.
Is there, and so then now now the parents have to approach this, from a Catholic perspective. And the Catholic perspective is we have to determine whether the care is considered ordinary or extraordinary, or sometimes we call it proportionate or disproportionate. So that's kind of the analysis we look at.
Right.
And so in the Catholic teaching on bioethics, if we deem it to be, ordinary or proportionate care, we're morally obligated to receive it. But if it's extraordinary or disproportionate care, we're not morally obligated to receive it, but it's still up to us to make that decision.
Of whether or not we should
whether or not we should
procure the treatment.
Yeah, and so
it reminds me a lot of the right to try laws that have been passing around the country, which is the idea to say, look, if I have, even though you might look at me and say you're going to die,
right.
If I have the will to live and I want to fight for my life, with maybe, a lot of times it's something that's at the final stage of FDA trial or whatever it is, I, as a human being, have the right to do that.
Well, I'll give you a classic example. I had a client come in and see me to get an estate plan done a couple years ago, and his cancer came back, and he had in his, what do you call those things, those lymph node things, and he had a nodule there. And so they were going to remove it, and they were going to start shooting radiation and chemotherapy and stuff through his brain, which was going to be really, traumatic for him and real painful. And so he came in and I said, well, let's analyze this. And I said, what's the likelihood of success of this treatment? Right. And he says, well, they caught it early enough. They probably got a good 70-80% chance. I said, that's great. So that kind of leans it over to the proportionate side, that there's a good chance of success to get it. But now we need to talk about the cost. What's the physical effect of this treatment? And he says, Brad, I've been told that when I go through this treatment that I'm going to want to die because it's so painful, so egregious. And I said, well, then it's probably clearly disproportionate or extraordinary. You're not morally obligated to take this treatment. And he says, yep, I understand that. I think that's a good analysis, but I'm going to do it anyway.
So he made the choice.
Yeah, I said, I said, why? And he says, because my first grandbaby's on the way. And he came back a year later to see me, cancer-free. And I said, how was it? He said, it was hell. He said, I thought I was going to die through that procedure. I said, was it worth it? He says, yeah, we got a second grandbaby on the way. And I said, would you ever do it again? And he says, no. He says, because I cannot emotionally, physically get prepared for something like that.
Right.
So that's a classic example of it's clearly extraordinary, disproportionate, but he made the decision he wanted to fight and take this treatment, and he's living today.
So we're talking about Charlie Gard, Brad Hahn, CEO of Solidarity HealthShare, Chris Faddis, what am I, jack of all trades?
Sure.
I like the janitor, cleanup hitter.
Yeah.
Yeah.
Well, just
Solidarity
to
HealthShare.
let you know, my teenager said, Dad, on these Facebook Live things, your career would be over unless it was Chris sitting there with you, helping you
Thanks.
out.
So I'm the co-host.
Yeah,
I'm like the color
co-host.
commentator. So Brad Hahn we're talking about Charlie Gard, and just one more thing I wanted to address. So obviously, hopefully people understand this. Charlie Gard's parents were fighting to get him released from the hospital in Britain so they could go to another hospital that could do the treatment. They weren't asking for money. They raised $1.7 million.
Well, the
Several
problem
hospitals
is,
offered
Chris,
it, right?
Yeah, you're right. The problem is, though, they went to the wrong hospital.
Right.
They went to a government-run hospital.
Exactly.
Yeah, and so then now they're analyzing, and this is the same thing that happens in Texas. You always hear a lot of articles and stories coming out of Texas. They have the 10-day fetal care statute, where a doctor or a hospital can say, we believe that your life's no longer worth living, so therefore you have 10 days before we remove all treatment. And then the parents or the patients start scrambling to try to find another hospital.
Right.
You know, that's the same thing that happened in England. Is if they would have went to a private hospital that doesn't take government insurance, they'd be making the decision.
Right.
Yeah, and so that's kind of what's happening in Europe right now. You have two systems. You know, the government system, which has a huge weight, or you pay cash and you get moved to the front of
and
line.
then you can make your own decisions.
Yeah, and you make your own decisions.
Right.
Yeah.
And the bottom line is no one's saying to do things unnecessary to hurt the baby. We're saying, hey, the treatment was actually rather innocuous. It wasn't something that was going to cause a lot of stress on the child. It was a pill.
It was a pill to
and it would or wouldn't work. They said 56% chance. And the bottom line is, at the end of the day, had the parents been allowed to do this back in November to January when they were first fighting for this, the baby probably would have lived and had a good, healthy life.
Exactly.
And unfortunately, because of this system and they had to go to court.
Yeah.
And the craziest thing to me is that the guardians in the court were not the parents. They appointed a guardian to speak for the baby. Because why would the parents be allowed to speak for the baby?
Yeah,
and then that guardian is involved with the charity that promotes assisted suicide.
Yeah, death with dignity.
I mean, it just is so baffling. And here's my question to you. You're the legal guy. I'm just a guy with an idea. So, am I wrong in thinking that this is where we're headed if we go towards a universal healthcare system in America?
Well, yeah, I agree. I think the answer is definitely yes, and we're seeing this in Oregon right now. And I can't remember the lady's name in Oregon who she was dying of cancer, but the insurance company that's run by the government there in Oregon, state government, said we're not going to pay for your cancer treatment, but here's a pill to euthanize yourself.
Right. They paid for the bill.
They paid, yeah.
And that happened in California right after the same type of law went into effect in California. A woman was approved for chemotherapy, and then 2 weeks, so then the law went into effect that next week. 2 weeks later, she gets a letter. She's no longer approved for chemotherapy. You have to take this pill.
Yeah,
But we'll pay for this pill. Not you have to take it. They're not forcing it, but they're only willing to pay for certain things.
Right.
And that, I'm sorry that brings me to why I think even whatever happens today in Congress, and we all know they're not going to solve it today.
Who cares what they do in Congress?
Whatever they do in Congress. We as Catholics, as Christians, as free-thinking people who believe in what the church teaches and want to live with freedom, we need to make a choice for our health care.
Exactly. And this is a classic example. I'm going to use a fancy term, subsidiarity.
Yeah.
So subsidiarity in the Catholic social teaching is societal problems or decisions should be made at the lowest common level by those that are most effective.
Right.
So like the Charlie Gard, who's the most effective? The baby is.
The baby is.
And who should be making that decision? The doctor and the parents. Not some judge, not some government or some insurance company.
Right.
And that's kind of where we're heading right now, because we've talked about this before, is whoever pays for the medical expenses, whoever controls the payer, controls the morals and ethics.
Right.
So who's controlling the payer system in this country right now? Insurance companies, and the federal government.
And the federal government.
Yeah, and so where's the Catholic social teaching comes in? So that's clear violation of the principle of subsidiarity.
Right.
So what we have to do now is what I love about medical cost sharing ministries and Solidarity HealthShare in particular is we restore that principle, to a truly authentic, because you and me, we get to select our doctor.
Right.
We decide what's best for our family.
But we select that for ourselves. We don't select the doctor for our members.
Exactly.
Solidarity. As the leadership of Solidarity, we let them select those doctors.
Right.
And we'll help them. I had a conversation today with a president of a major hospital, and I explained to him how things work. And I said, we're not putting our patients in a model where our members in a model where they have to use you.
Right.
But we would like to have a partnership with you so they can choose you.
Exactly.
And he actually said, wow, that's refreshing.
Right.
And this is the head of a major children's hospital.
Yeah. Well, I'll give you another example is the client I told you about the story about, getting the procedure done to save his life and the grandbaby's coming. His cancer came back.
Yeah.
And he's retired, so he's on a retirement salary. And his Obamacare plan, he's paying $2,000 a month just for him.
Wow.
He's in his mid-50s, and his deductible's $10,000. So he goes back to that same surgeon who saved his life and said, I have my Obamacare insurance here. And the surgeon says, I take that insurance, but the problem is the hospital where only I'm admitted to the procedure does not take this insurance.
Right.
And so he calls me, he says, Brad, what am I supposed to do? I said, I'll help you negotiate the best cash price at that hospital. So look at this guy spending $2,000 a month, $10,000 deductible.
Right.
How much he's into this right now? Now he's going to have to go come up with another $15,000 to $25,000 to pay cash at the hospital because he wants to use that surgeon who saved his life last night.
Right, and he's not allowed because
Yeah.
And that's the rigmarole that people are in. I had some crazy stories today about similar things. A family that went from $550 a month pre-ACA to $2,100 a month, and now it went up to $3,100 a month plus. It's a $10,000 deductible per individual in their family.
Right.
That's insane.
Yeah,
Most of us can't even afford
afford that.
And we talked about making it affordable for low-income families. How can a low-income family on a bronze plan pay $7,500 out of pocket?
Right, exactly.
It's impossible. They're never going to pay the hospital.
Well, then, so now you don't choose the Obamacare plan.
Right.
Now what does the federal government do? They fine
you. Right.
Yeah.
So here's what we're about: solutions. Though we're not here about problems. So Solidarity HealthShare is here to solve that problem for a lot of Americans who want this. They want, and we're hearing this. I was on the radio yesterday. A great show on Relevant Radio that you've been on, the call-in show, and to hear these people,
is that Wendy Weiss?
Wendy Weiss, yeah. And to hear their excitement and their energy and their wow, this is available. And of course, there's questions. So we want to answer your questions. So I'm going to look and see if anyone has asked any questions. So far, I don't think so. We got a couple good comments. But if you have a question about health sharing, we had a lot of questions yesterday. One of the most common questions we get is how do we handle pre-existing conditions?
Exactly.
And so I think it's important that we're upfront about that because we're bare bones. I mean, we keep the cost as low as we possibly can. That was an explanation. Someone said, why is there an admin fee with health sharing? Because we don't have exorbitant inflated costs that we can absorb all that in. So you're going to pay for what you get. And so with pre-existing conditions, we simply, our hearts would say we want there to be coverage for those folks. We simply cannot just take on every pre-existing condition and share in that because we can't afford it. We need to protect our members' dollars. Yeah. But I think we've gone really far to try to extend that.
Right,
so
exactly.
Can you talk a little bit about what we do for pre-existing conditions?
Yeah, sure. There's pre-existing conditions are treated in one of two ways. The first way would be is if we have a condition that can justify and warrant a lifestyle change. So like if we have high blood pressure, overweight or something like that, we would take them as a member, and those pre-existing conditions would be fully shareable from day one if it's pursuant to our member guidelines. But we assign them a coach. Right. Yeah, and then the coach, it helps them. They check in every couple of weeks to talk about diet issues, about exercise issues, to try to return to a healthy lifestyle. So that's one way we share in pre-existing conditions. The other way is if we receive them as a member, and it doesn't justify a lifestyle change, maybe a sore back or something like that.
Right.
Yeah. Then what we do is the first year you're not eligible for sharing in any medical existing condition and pre-existing condition. But year 2, it's up to 25, and then year 3 is up to 50, and then thereafter, then it's fully shareable.
It's fully shareable, right? And you're essentially grandfathered into the program as a full member. And the great thing about that Health Track program as well is that they're a full member, fully shareable for those expenses. Even if it is diabetes and they're in Health Track and they have some expenses,
exactly.
That's all of those eligible expenses are shareable, which is really important, right? That people understand that. And I think it's interesting because we hear a lot of people who are in those programs, and most people, I don't like being told that I'm overweight. We all know I'm overweight, but I don't like being told it. But the reality is that I know that my healthcare cost is more expensive. I am at risk for more things, and over time it's going to be more. So I welcome the help to be coached and encouraged, because a diet and losing weight isn't as easy as everyone thinks. I mean, something might work for Brad that doesn't work for me, and vice versa. And so we need that coaching.
Yeah, exactly.
And that's what I think is great that people are getting. And I'm hearing great things from our members. I mean, you have a family friend who talked about how much she's enjoying the program.
Yeah, exactly. My sister-in-law, she loves it. And so she was hesitant. She didn't want to get off the program because she had so much fun getting, tracking the goals.
Yeah, we have people who are asking to stay on the program, and I think we're looking at that as an option, that for families who say, well, I'm not required to do this, but I want to do this, that's something they can join.
Yeah, exactly, and that's what we're looking for too, is we can try to take more people with pre-existing conditions, and we talked about that stewardship or that advocacy program that we're looking at implementing soon, probably in the spring now.
Yeah.
Which would be a way where if you have a pre-existing condition and trying to navigate all those waters, do I do this, do I do that? Well, wouldn't it be nice to have a third party?
Right.
That's
helping you navigate and guide and giving you the tools to make the right decision.
Yeah, exactly.
Right?
Yeah.
And that's something that I think is interesting. Just for those who are joining us, if you've never heard of Solidarity HealthShare, Solidarity HealthShare is a ethical and affordable way to pay for medical costs. Our members, the majority of our members actually don't use health insurance. Instead, they use Solidarity HealthShare as their vehicle for paying for medical costs. We share those dollars among members, so when I have a bill come in, it's actually the member dollars, so it might be Brad's dollars that are going to be paying that bill. And it's all done electronically, so people ask us all the time on these live chats, what's different about us and other healthcare sharing ministries? First of all, understand we love that healthcare sharing is here, and we owe a lot of a debt of gratitude to those who have been here for a long time.
Yeah, those great pioneers.
Thank you for that, and we're grateful. But why we really set out to kind of build a better mousetrap, to take away some of the pain points. So Solidarity HealthShare is here to serve you, but what are some of the pain points that we've tried to solve with our systems?
Yeah, there's some ministries out there that if you get sick or injured and it's a shareable expense, you'll get checks from like 10, 15, 20 different people that you then have to go to the bank, endorse them, and sign them up. Well, to get around,
and then you pay the bills with those checks, right?
Bills with a check. Well, we try to cut through all that because that can be burdensome for some people. And so what we do is once the bill's submitted for Solidarity, and which really beautiful, what we do is we run it through our computer system, our computer programs, to make sure it's a fair reference-based price, cash-pay, self-pay price. So that's the first thing Solidarity does. And the second thing Solidarity does is says now we accept that bill to be paid to the provider, and then the computer automatically allocates from other people's share boxes, other people's accounts, to put it into that account to issue the check to the provider. Yeah, and so it's more transparent, and it's more reliable because we know the check is going directly to the provider. And the members like it because they don't have the hassle of endorsing all those checks.
And they don't have the hassle of collecting all the bills and sending them. That's another thing, is the payer ID on their card that they can have the bills sent directly.
Exactly. That's a great point.
That's a huge one. I mean, we were with another health share previously, and it was great, but we had to create our own spreadsheets, to like track everything and to keep all the bills in order and then submit them, and it took forever. So this is a much faster, smoother, streamlined process.
Yeah, well, there's a couple ways that can happen. That's the question I had yesterday from one of my clients saying, well, Brad, how does this work?
Yeah.
So I used basically two examples. One example is when my son Andrew went around the beach last week, so I did take a vacation last month.
That's right.
Yeah, and so then he got an ear infection.
I didn't take a vacation.
Yeah, so he got an ear infection. Then we took him to the doctor, to the urgent care, and the urgent care said, well, we don't take insurance. I said, well, why not? And he says, because it's a hassle. We have to fight with the insurance company, we have to wait for reimbursements. And I said, well, we have Solidarity HealthShare, we're not insurance. He says, well, we'll gladly accept that. And so just to give the guy some burden, I wrote the check for $125, or gave him my credit card, and then I submitted the bill to Solidarity, and Solidarity reimbursed me, because I didn't want to burden this guy, because he didn't want to deal with anything.
Right.
But now he wants to be one of our recommended providers.
Now he wants to deal with it because it was so easy.
Yeah, because it's so easy. Yeah, and so then the other story is when my son got kicked, same son, I guess, he's the one that accumulates over medical bills. But when he got kicked to the calf, had to go to physical therapy, Julie walks in and says, hey, we're cash pay clients. Self-pay patients.
I'm hearing that we need to be louder, so we'll try to be louder.
Okay.
So I'm going to pull it a little closer.
Yeah, sure.
Keep talking.
Yeah, so we're a self-pay patient. So Julie went in and negotiated an $80 per visit price, and so that was we thought a fair and reasonable price to pay. Well, they submitted the bill to Solidarity for $290 per visit, and that really upset Julie. So at that point, Solidarity may have called and questioned the bill, but Julie says, no, I'm taking care of it. So she called and said, what are you doing here? And you know what they said? Well, Julie, we thought this was insurance because you gave us a card, and so we billed you like insurance. What we do is we overbill and see what sticks.
Yeah.
And Julie says, that's not how we play this game.
No.
Give me your best price.
And you know what we've seen? We've actually had providers that have done that, right? We get a big inflated bill, and then we send them the reprice, the right price, which is fair and reasonable, is what's available out there. They always accept it pretty much, 99% of the time. And what I've noticed is some of those providers have started billing us at that rate.
Wow.
So instead of billing us at the inflated rate, they say, oh, this is how these guys play, great.
Yeah.
And they just send us those bills. So we're no longer getting discounts on it because we're getting the actual rate, right?
The actual fair and reasonable
Which is
price.
what it should be. Let's say, I was looking at stats today, general family practice doctors spend 60% in overhead.
Yeah.
And a doctor who does
Chasing
direct
insurance
primary
companies,
care, right? Most of that's chasing insurance companies. Whereas a doctor who does direct primary care, which means that they're taking a fee from the patient directly, they're not dealing with insurance, their overhead's 18%.
Wow.
There's a 42% difference in overhead between taking insurance. So Solidarity wants to make that. And that's something, if there's any doctors out there, we would love to have you on our provider list because that's what we're doing. We want to make this simpler for you. That's what I told this hospital CEO today. I said, look, we want to pay you ahead of time if we can.
Yeah.
He said, you don't want to have to wait and carry all these balances. We want to do that. And so our members are paying monthly. We're stewarding those dollars and making sure those bills are paid. And we can do that in a way that's reasonable to the doctor. We want them to be paid well, the hospitals, all of that. I think you coined the term, the doctor should be the highest paid person in the system.
I want the surgeon to be the highest paid person in the system,
right?
not an insurance company.
Exactly. Or the lawyers that are defending everyone.
Well, the lawyer should be paid.
No, the lawyer should never get paid. But Brad's a lawyer if you didn't know that. So if that turns you off, I shouldn't have said that.
That's okay.
So Solidarity HealthShare is here to help you with this fiasco we're in with healthcare. Our members are loving it. I heard from another member today who just said, I just sent an email to my state legislator letting them know how much I love being on healthcare sharing. How great is that? That was in Arizona, actually. And it actually helped that I met that legislator today. So there's people out there that are telling people about it. And if you're a member, we'd love you to comment on why you like Solidarity HealthShare right in the comment box. This video will be out there for a long time, so it helps people make decisions. If you have questions, let me see. I haven't seen any questions. This is like the least amount of questions.
Well, we can keep talking.
I think it's because we were not able to be heard. Can you hear us now? If you can hear us, give us a thumbs up and maybe a comment. I think I got a thumbs up. So
okay, good. Let's talk about repeal and replace.
Thank you. Repeal and replace. Let's go there.
Or keep and kind of.
It's funny because everyone is. This is like a big day. Like, we'll see what happens today. And I think a lot of us are saying nothing's going to happen.
Well, I just say make Congress irrelevant in your life and how you pay for medical care. And so to me, the most frustrating thing is while the Affordable Care Act caused the premiums, like even in the state of Arizona, to increase like by 116%. And who's suffering through all this? When John McCain went to get his checked out his brain for the brain cancer that he has, he is not on an Affordable Care Act plan. Right. And so this whole mess of the debacle of the Affordable Care Act is affecting the small people in the country. And they're screwing around back in DC trying to find the solution. Well, we have a solution here. Yeah. It's called Medical Cost Sharing Ministry with Solidarity. So the reason they're repeal and replace, whatever you're going to call it, or keep and bastardize, that'd be a better way to say it, is what they're going to do is they're not addressing the fundamental issue in this country. Right. The fundamental problem, and you talked about this with the CEO of the hospital today, is that there's no transparency in billing. Right. And so no one pays retail in anymore in medical, but that's what's being billed. Right. And so then whatever negotiation power you have, then it negotiates down to a fair and reasonable fee. Well, why don't we start with a fair and reasonable fee? Just start there. Yeah. That's what, it's interesting. I use this example a lot, and I don't know if I'm allowed to say this on here, but the store rhymes with Kohl's, okay? So, you go to Kohl's and you see these the prices, and you go, okay, why is that 75% off every weekend, right? But if I go on a Wednesday, there's been times when I'm like, my belt broke or something happened, and I refuse to buy a belt at regular price because I know the actual price is 75% off or whatever it is. And it's so frustrating to me because anytime you buy anything at a store like that, that's doing these every weekend 80% sales, 70% sales, you're overpaying by a ton. But every day we do that in healthcare. Exactly. So we get bills that, somebody billed for a stroke, it was $74,000. When we went through the fair, reasonable pricing, it was actually $14,000 and the hospital accepted it. Exactly. Why do we continue paying those bills in that way and continue playing this game? And it's a mess. Is it the hospital's fault? Is it the insurance company's fault? It's a both and. Yeah. Exactly. And it's our government's fault. Yeah, they're playing the game. How they played the game. Yeah, and so now the solution is not to bust through that transparency. And so the Congress's solution right now is let's subsidize
Right.
fiscally the insurance companies.
You told me the other day the percentage, what was the percentage increase in profit for insurance companies?
About 16% last year.
Okay, so.
Yeah. And that's our money.
That's our money,
Yeah.
right? And we're subsidizing that. Now, granted, we need to provide ways for pre-existing conditions to be
Right.
shared or to be covered. We need to provide things for the poor. One thing I hadn't even really thought as much about is all of the children who are on Medicaid programs. We cannot cut those programs for those children. We've got to do those things, but that's a problem that is for Congress to solve. And I think what we're just saying is let us practice our own healthcare and let us serve like the free market. Let me go to my doctor, get a good price. Let me work with Solidarity HealthShare so I can get good, reasonable prices for my sharing amounts every month. We pay $450 a month for our families.
Right. Yeah, but we're also overlooking another issue because we're talking about price and transparency and stuff like that. But the other thing is a religious liberty argument.
Right.
How do I protect my conscience? So when I'm in an Affordable Care Act plan, I know that my money is going to go to subsidize abortion, contraception, abortion-inducing drugs, gender reassignment surgeries and stuff like that, because that's under the federal law. You have to do that. But with Solidarity is we have the right now under the Affordable Care Act, the United States Constitution, the Bill of Rights, Declaration of Independence, however we go, is we have the right to not to have our consciences violated.
Right. And
so for me and my family, and your family, we decided consciously not to violate our conscience.
Not to participate
not to
in
participate.
moral system.
Right. And so that's what we're doing.
And in turn, by being faithful in that way, we've been rewarded with lower cost healthcare.
Exactly.
With choosing the right providers, I think we're both, we talk about our healthcare all the time, we're both getting great care from great physicians, our families are well cared for, and we're not burdened by the 24, 30, 40% increases that some families have had year over year.
Just like that urgent care visit with Andrew in Oceanside. Right. The doctor and the nurse and the doctor practitioner, whatever, the physician assistant, they spent a half hour with Andrew. Right. And I was like, this is the most thorough exam I've ever seen.
I had that, my first healthcare sharing, my daughter got a flu in the middle of the night, spiked a fever, and we're in an urgent care, and the cash pay price was $135. Well, my previous insurance plan, $135 was the copay. Right. Or whatever it was, $140, whatever it was. And I just thought, it was less expensive, whatever. So there's a good question here, and I think this is good. Someone said, I know this is a Catholic-based program, which I get the benefit of that, but I'm concerned about the user base because we're a newer organization. And I think that's an important thing. We are newer. I will say we're currently on track to become the fastest growing healthcare sharing. We are the fastest growing. And so let's talk about that honestly. Let's talk about numbers. Where are we at with our user base, and how are we supported in a larger scale? Yeah, well,
with us is I was the most skeptical of medical cost sharing when you and Johnny approached me 5 years ago, and I started doing my research. And I looked at the medical cost.
I should have just given up trying to convince you. Now I'm stuck with you.
Yeah. So with the whole medical cost sharing, I analyzed the last 40 years of it. And what's really beautiful about this is there's about a few hundred Mennonite churches that do it. And the Mennonite churches make it financially solvent with only like 35 families. Right. Which is amazing how they do that. And there's some smaller ministries with a few hundred, that have been surviving for the last 20 years. And so to me, that's a true blessing to do that.
It is, yeah.
And so, but me, I didn't want to sleep at night until we got to 1,000 households. Right. And once we get to 1,000 households, which we just hit today, member households, to me, I sleep a lot better. Right. Yeah, and I think it's a great sleep.
And it's important to know that at 1,000 households, we're growing by 200 households a month. Right. Which equates to about currently over 3,000 members. And so close to 600 members a month that will continue to grow. But also, we're sharing at 60% of our sharing power, which means that every month we share at 60% of the dollars available for sharing. The other 40% is there to share for future needs. Right. And it continues to grow in the member accounts and their member share boxes. And so that's what's happening today. Will we have months where we're going to get up to 80 or 90%? Of course we will, but those extra dollars continue to help that. So we are sustainable. We've had cancer cases already. We've had strokes.
Of bills.
Yeah, we had a bill the other day for $169,000. Guess what the hospital took? That would be a fun Facebook Live. Have people guess. $19,000. I mean, we've been able to share those, and we've been able to steward those member dollars and be fiscally responsible with them so that we can share in that. So I understand that. One thing that was said on the radio, and there's other things we have kind of thought through and planned to help continue that. Yeah. But rather than sell you on that, I think it's important we consider this. Fiscal responsibility is important. Stewardship is important. We take that to heart. That's why I don't sleep well at night, because I'm constantly thinking, are we being good stewards? I'm constantly praying through this. And I think we are. I think we can do better. But I think we're continuing to do that. But what somebody said on the radio yesterday, a gentleman named Brandon called in, and I want to take him on the road with me like a little puppet. He said, what I see in this is a true radical trust in divine providence. Yeah. And there has to be that element in Catholic healthcare sharing. We have to trust God. We don't have to trust, we don't be blind and not pay attention to what we're doing, but we need to trust in God. We need to place our trust and say, Lord, I'm doing this faithfully. Right. We're respecting our morals and conscience. We're making a decision to do something different in order to do what the Lord wants of us, and now we must trust in Him.
Exactly.
And that's an important piece.
Yeah, well, that's why we're forming this community.
Yeah.
This is very modeling of the early Christian communities right after Christ, was ascended.
Right.
Yeah, it's beautiful because Catholics would come together. They would bear another one's burdens, financially, spiritually, take care of the poor, the widow, and the lame. And that's what we're trying to do here is with medical cost sharing is how do we effectively, in a cost-effective manner, and not violate our conscience, have an alternative way to fund our medical expenses.
Right. And this is the way to do it.
Exactly.
Directly with our family and friends.
Yeah. Because we control the ethics and the morals.
Yeah.
Based on the teachings of the Catholic Church.
Based on what the Church teaches, not what we or our body, wants.
Yeah.
And ultimately, people say, well, what if I don't agree with that? Well, then don't join us. Right. I mean, we're going to. What you will know though is in that piece of choosing those things that are ethically and morally acceptable by the Church and encouraged. We're also getting rid of all of those erroneous expenses that aren't necessary, that are kind of making the cost rise.
Exactly.
And so that's an important piece that I think the reward of being faithful is that the cost is lower.
Yeah, exactly. Like one of our members I was talking to on the phone, he's actually a radio host, and he was saying, I knew it when right when my son, I knew he slipped and fractured his bone in his arm, and I knew it was bad. But I know it wasn't severe where he needed immediate treatment. So he says, I decided I'm not going to go to the emergency room because I know what they're going to do. They're going to submit a bill for $50,000 and slap a cast on. I'm just going to wait in the morning and go to the orthopedic surgeon.
Wow.
Yeah, so that's what he ended up doing.
Direct care.
Because I'm going to go directly there, and it saves Solidarity, tens of thousands of dollars just by that decision.
And it's not to say you shouldn't go to the emergency room, because you certainly can, but to know those, and that's where I think you're going to see more and more from Solidarity in the next 6 months is educating our members on those things, being able to call a teledoc and get some advice or different resources, or saying, hey, how do I find the best price for this? Now, Brad and I have to get to another meeting, so I think we're going to end this. But what I want you to know is that we are 1 year in full operation where we're open to the public. We really only started marketing last October, November, and we have 1,000 households. So this is a day of celebration for us because we went out on faith 5 years ago to start this project.
I did my legal analysis.
Brad did do a legal analysis. Yes.
You stepped out in faith. I stepped
out in faith, and Brad had to, took about 4 years to prove it to himself. Yeah. But God has been faithful, and so we're so grateful to our members. We're so grateful for you coming here today to learn about healthcare sharing. If you have more questions, we want you to go to our website, solidarityhealthshare.org. You can also go to our call center, 844-313-4999. We'll put those links in the comments as well. 844-313-4999. Actually, our call center reps are probably more equipped to answer questions than we are. And oftentimes the questions are personal because it's dealing with medical. So please call in. We're available till I think it's like 6 p.m., 7 p.m. Eastern time. I should probably figure that out, but our hours change sometimes. So we're available there. We want to have you as a part of our community. And Solidarity HealthShare continues to grow. I would say by this time next year, Brad, we'll have at least 10,000 households.
We better.
Maybe 20.
Yeah.
So look out. Solidarity HealthShare is here. We're trying to build this authentic Catholic healthcare system, and we want you to be a part of it. I'm just going to make sure there's no questions. We're still good. I think we got all our questions answered, and I'm guessing all 60 people on here are just going to join. So that's great. So thank you. God bless you, and we'll see you soon.
Thank you.
I think I have to end it.
Yeah.